Hi, I'm Jessica Brees with the Center for Midwifery at the University of Colorado Hospital. I am a certified nurse midwife. Today I'm going to talk to you about positioning in labor and birth with an epidural. When women first are given an epidural, they are instructed by nurses and anesthesia as well as their provider to never lay completely flat. They always need a wedge or a tilt under them. So typically, after the epidural is initiated, a woman is going to be laid more in a reclining position, and then a wedge or a towel, blanket, or pillow will be gently placed under their hip, and then they'll be asked to roll back a little bit more onto it. Every hour, it's advisable that women then switch sides. So again, you'll be placing a wedge. The woman's support person can also do this. Many women have the ability to lift and move their hips. They also are able to use their legs with a good epidural. There are so many other positions that are beneficial for women to get into with the epidural that can help their labor progress. Basically, the woman will rotate completely over to her side, and she typically will be able to do this with herself. But if she's having difficulty controlling the lower aspect of her body, she can utilize the nurse and her support person for assistance. The key to the modified Sims position is that you have the lower leg as straight as it is comfortable to be so, and then the upper leg you're going to bring as high up as you can, almost so that you're rolled onto your belly. This allows the pelvis to rotate in a way that will encourage the baby's head to rotate through the pelvis. This is a great position if your baby is posterior and you're trying to encourage your labor to progress and the baby to descend further down into the pelvis. I usually recommend switching sides from side to side in this position every 30 minutes. You can do other alternative positions to encourage your labor to progress and your baby to rotate through the pelvis. The high Fowler's position is this position, and it encourages gravity to aid in your baby's descent into the pelvis. An adjunct to the high Fowler's position is a position that I like to call the throne position. You can have a woman sit a little forward, place the pillow lengthwise behind their back, and all of these birthing beds are equipped to lower the foot of the bed. This is a great position just before you're ready to start pushing. We like to support the knees in this position to make it more comfortable with blankets or pillows. And then you want to open the pelvis up. You want to not stay in this position for too long, or the effect of the epidural may wear off. As the medication will slowly start to sink in the lower aspect of the body, it won't provide as much coverage abdominally. The optimal time to get an epidural, if that is part of the plan for birth, is when women are in active labor and at the point that they're not tolerating the sensations of labor. And then that epidural will continue throughout their labor and the pushing experience, and possibly for an hour postpartum should they need any suturing.